Let's talk about women and alcohol. And we'll also talk specifically about young women and alcohol. I'm a psychiatrist. My name is Dr. Lewis. I work with kids, young adults, and adults. And this is one in a series of talks about addiction. So let's talk about some recent trends. So overall, worldwide, women are reporting higher levels of stress, higher levels of anxiety, higher levels of sadness. There has been like a number of different studies, different surveys and research studies looking at women in this country, around the world. And overall, there is this trend that's like a worrying trend of an increase in issues with mental health in women and in young women. And with that trend, there's also an increase in alcohol use disorder in women. So what is alcohol use disorder and how do we diagnose it? So the DSM is like the diagnostic guide used in the US for deciding if someone meets or doesn't meet a criteria for a psychiatric diagnosis. And there are 11 criteria used to diagnose, and it's basically measuring certain behaviors and their impact on health and well-being. So here are some things to watch out for. Drinking more than intended, or inability to cut back, or spending a lot of time drinking or recovering from drinking, having strong cravings for alcohol, continuing to drink even though it's causing problems in relationships or at work or at school, prioritizing drinking over all kinds of other activities, doing dangerous things like drinking and driving. And drinking even though it's worsening health issues, because we know drinking can worsen health issues. Also increased intolerance, so like needing more to feel the same effect, and withdrawal, right? So withdrawal are symptoms when not drinking. So these are some of the symptoms, right? And that's how it's diagnosed, to have a number of those symptoms. And historically, we thought about alcohol more as an issue for men, and the rates of drinking were higher for men. But it's changing, right? Now, women in their early 20s are drinking potentially even at higher rates than their male peers. And drinking can be used to numb emotional pain, but when it is used that way, and that's often how young women use it, it increases the risk for dependency. So why does alcohol affect women this much, and why is it even harder on women than on men? So it's unfair, but it's just how it is. Like, the way that women process alcohol is different than how men process alcohol. Women have a lower tolerance. It takes less for more damage, right? So we have less water in our bodies, right? So it's less distributed. So the same amount of alcohol has a bigger impact on women. And women also have higher rates of alcohol-related health issues, like more liver issues, brain issues, heart damage. And there's a rise in alcohol-related illnesses in women, like cirrhosis or liver cancer. And that's all because women's bodies are different, right? So we're biologically more vulnerable to the effects of alcohol, and because we process alcohol differently, there's an increased risk for all kinds of things, right? For liver issues, brain damage, heart issues. There's also this increased risk for cancer, right? From any amount of drinking, which is really concerning. There's also increased risk for women being victimized, right? Exposed to sexual victimization, rape, right? Related to drinking. There's also a higher risk for death in a car accident for women when drinking and driving. There is a link between mental health and alcohol abuse. So trauma is a very significant factor in developing alcohol use disorder, and childhood trauma, right? Disruptions early in childhood with attachment and trust, that's a concern. Also, women are particularly vulnerable to sexual trauma and are more likely to develop PTSD following sexual trauma. And that will create this vicious circle of then that increases the risk for alcohol use, and the whole package of all of that mess is hard to overcome. But there is treatment, right? There are effective treatments for alcohol use in women, and getting help, reaching out for help is really important. And it might be important to address the underlying trauma, but the beginning is to just get a mental health professional or some kind of a medical professional involved, have an assessment, right? Like assess where are things, and learn like what are the treatment options, what's appropriate for you depending on what's going on. I have a bunch of other videos about Sinclair method and recovery, and there's women often don't want to, and women and men with drinking issues don't want to enter treatment because they are not willing, ready, or interested in abstinence, right? So a lot of the, at least in the US, a lot of the treatment for alcohol use is abstinence based, right? AA, things like that. You have to be completely sober. The goal is complete sobriety, and a 22-year-old college student may not be interested in that, right? Or willing to go to AA or something like that. But treatment works and is available even if someone is not willing to be completely sober and completely quit, right? Even if you're not interested in abstinence, even reducing from heavy drinking or very heavy drinking to moderate drinking, right? Or going from moderate drinking to light drinking, right? So maybe going, for women, like very heavy drinking, right? That's more than 4 drinks, right? So going from 4 drinks to 2 drinks, that's already a huge improvement, right? And going from 2 drinks to 1 drink per day, right? That's an improvement, right? It's not, it's not abstinence, but it will benefit everything, physical health, life, relationships, to cut down. And there are nowadays like less stressful maybe ways of getting help, and like maybe check out my video on the Sinclair method, right? How to use a medication as needed, right? Just to make it easier to drink in a way that feels manageable, right? There's also, this is like a much bigger thing about just addressing mental health and addressing like stuff that women deal with, right? To like lower the emotional distress that pushes someone towards alcohol, right? And developing the skills to deal with life, right? Emotional regulation, distress tolerance, interpersonal skills, boundaries, ability to set boundaries, assertiveness skills, self-care skills, right? Just developing all of that, of course, will also help in overcoming alcohol use disorder. And the like recovery, whether it's just cutting down, right, or complete abstinence, is a process, is a journey, right? It takes time, and the foundational piece of that is self-care. So thank you for watching, and see you next time.